So HIV is a virus which damages the immune system of infected individuals, meaning that they cannot fight infections properly. Although there's no cure, there is effective treatment which can reduce the amount of virus in the blood to very low levels, which allows the immune system to recover. And in addition, researchers recently confirmed that once a person has achieved this so-called viral suppression, they're unable to pass the disease on to anybody else. So treatment has benefits both to the individual and also to society as a whole. The cascade of care is a model which describes the steps that an infected individual needs to pass through to achieve this goal of viral suppression. So it can include things like being diagnosed in the first place, being linked to care, and starting on treatment. And it's widely used as a tool to monitor the progress and the performance of HIV healthcare systems over time and to identify gaps in care which need improving. In 2014, the ambitious 90-90-90 treatment targets were announced, with the aim that by 2020, 90% of infected individuals would know their status, 90% of those who'd been diagnosed would be on treatment, and 90% of those on treatment would be virally suppressed. My PhD is looking at this cascade of care specifically for infants in South Africa, and South Africa is the country with the largest number of HIV-infected people globally at around 7 million. And the prevalence is particularly high in an area called KwaZulu-Natal, which is a deprived rural area in the northeast of the country, where more than 1 in 3 people are infected. And this is the area that I'll be focusing on. So the work I've done so far is looking at the first step of the cascade, so that's the testing of babies born to HIV-positive mothers. And South Africa recently became the first high HIV burden country to recommend routine testing of all infants, all HIV-exposed infants, as soon as they're born. But because this test might not pick up babies who became infected either late in pregnancy or during labour, a second test when they're 10 weeks old is recommended as well. But there are practical difficulties with this. For example, how to explain to a parent whose baby tested negative at birth that there's still a risk they could be infected. And it's especially difficult in the context of a rural community where people often travel long distances from their homes for medical care. In my research, I've observed that after being tested at birth, only 23% of HIV-exposed babies received their second follow-up test. This could result in a huge number of missed infections and, in turn, high mortality rates, since without treatment, around half of babies will die before their second birthday. Future work will aim to identify the characteristics of these babies who are dropping out of care and the reasons for this in order to improve infant testing strategies.